we're so focused on prevention in that arena. I think more so because we have the medications to treat preventatively more so than because our actual concern is there. But I think it's more commercially driven.
We've got one more thing to say about the medical practitioners who don't know about gluten tests. Interestingly, I've had a person begin to work with me, and I've been training her for the last year. And what happened is she had never asked for gluten antibodies or celiac markers on her patients, not because she didn't know about celiac disease, but she didn't know how to interpret the test, and she didn't want to look ridiculous or silly when the patient came back and the results came in, and she didn't know how to interpret them or what to do about them or who to send on to the gastroenterologist. And where she had been working, the waiting list for seeing specialists was very long, and so she just didn't bother. But now, under my tuition, she's doing blood tests on every single patient she sees for gluten and celiac disease, and she is staggered at how many people have got the gluten syndrome, and she has wholeheartedly adopted a gluten-free diet for herself and her family. Her child got celiac disease. I diagnosed that, and that she can now see that over her previous life of medicine that she has actually not served her patients well because she's never thought to investigate things. To overcome this, I've launched, I think I told you, the e-clinic, which is an electronic way of helping people understand exactly what the results of their blood tests are, so that most people don't know what tests have been done to them in their medical notes, let alone what they mean. And I'm encouraging my patients and other patients to know exactly what blood tests that they have done, and then get help with interpretation. And I've got an interpretation website, and they can put their blood test results into the system, and they can get an opinion about what their blood tests mean. Because once the patients, once the community gets the tools to be able to interpret what's been done to them and what their tests mean, then they can help drive the whole gluten revolution, and we can see at last this education about gluten sensitivity getting through.
That's fantastic. Is there a website that they can go to? Could you say that for us?
Absolutely can. It's my name, Dr. Rodney Ford, all one word, .com. drrodneyford.com, and you can find me. If you can't find that, Google me, Dr. Rodney Ford. I'm first on Google, and do Ford and gluten, and you'll find me. So if you want to write a message, send me information. And there's a YouTube I've just done about that, explaining that. So look at Dr. Rodney Ford on YouTube, and you can hear how this e-clinic works. And we've got a lot of excited customers. It's only been open for about 10 days, and so we haven't promoted it yet, but we're getting some nice feedback.
Fantastic. It's good to have another tool that we can refer people to use. I want to wrap it up here shortly because I don't want to take too much of your time, but I did want to get your opinion on one other topic, and that is the research on HLA-DQ1 and HLA-DQ3 as being potentially the neurologically associated genes with gluten sensitivity.
That's about all I know about it, that these DQ1, DQ3 genes do seem to be associated, and with gluten sensitivity. It's the DQ2, DQ8, which are associated with celiac disease, with the gut damage, but some of the other DQ markers are associated with gluten sensitivity, and I think there's only one that's not related to it. So I don't know anything more about that, and unfortunately in our labs here in New Zealand they will only do DQ2, DQ8 and will not do the other genes unless we ask very specifically, and they cost about $500, so the patients aren't particularly willing to do that. But it's a research project, and I'm very interested to see where this genetic proclivity goes.
I've got about 2,000 samples genetically where we've been able to break down both the DQ alpha and DQ beta 1 genes, and I just haven't sat down to plug in all the data yet, but we've got the samples, we got the different disease diagnoses in these particular individuals, and I have found a lot of really neat correlation with some of these gene markers. And just as a side note, I had a little boy, this was about 6 years ago, a young boy. He came in to see me. His mother brought him in to see me because he had juvenile rheumatoid arthritis. And he was terminal. They had given him about 6 months to live. He had a permanent stent put in his arm because he was in and out of the hospital so frequently. And I wanted to, along with the story, I want to get your take on this. One of the things we tested him 2 ways. We tested his antibodies in his serum for anti-gliadin, but we also tested his stool. If you're familiar with Interolab, we used Interolab to test for stool antibodies.
I'm familiar with that, yes.
And they all came back negative. Both blood and stool came back negative. And the only thing that really came back with association with gluten were his genetic markers. And so I wanted to ask you, of course, we took him gluten-free, and he's doing fine even still today. So the story ended very well, at least so far. What percentage of patients would you say that you see as you do your antibody testing? What percentage of those patients are coming back negative but still respond to a gluten-free diet?
That's a fantastic question, Peter. And that's where we get into more guidelines and medical guidelines and what is reasonable to do. The first step is to diagnose celiacs and put them gluten-free, and that's not done very well. Most celiacs have not been diagnosed. Most people are not being tested, so that's terrible. Once you've got to that stage, then you want to put people gluten-free if they've got gluten syndrome, and there's only one test that I can see that is useful, is either the blood or the stool gliadin antibodies. And a lot of people have these high antibodies. For blood testing, 10% of the population have high gliadin antibodies in their blood, and of my clinic, I do tests on everybody, and we've got 60% of the people who come to see me who have a blood test have got high gliadin antibodies. All of those people go off gluten, and 8 out of 10 get better. Then there are the 40% who have negative gliadin antibodies. If we did stool antibodies on those, half of those would be positive, but we don't have access to stool antibody testing, and it's Ken Fine's lab, the Intro lab in Dallas, and it's a wonderful lab, and the stool antibody is very useful. So what do we do with the people who are symptomatic, who've got negative gliadin antibodies? Well, many of the mothers will take their children off gliadin anyway, gluten anyway, and especially if they are siblings. If they've already got a few people gluten-free in the family, they put everybody gluten-free.